patients, you request to get from an insurance company physical therapy visits or any kind of visits or any kind of procedure, you get a denial or you get a limited number of visits. And the patients, especially those who cannot afford to pay out of pocket, they are on the shorthand of this, and their care and their life, their quality of life is compromised. And I believe that the musculoskeletal ultrasound technology can offer a significant help within a rehab, physical therapy, rehab medical office caring for patients with musculoskeletal problems to offer solutions. So, Costa, I want you to start discussing first this very issue on what impact this can have, this technology can have in patients who come in within a physical therapy or medical practice.
Thank you very much for the invitation, first of all. And it is a phenomenal subject to talk about. And one of the reasons that Dr. Rawat, myself, Dr. K, the whole idea of what we represent came about, it's because of the healthcare system and the concept of the failed physical therapy. What is that? Okay, say you have a patient that, or a client, they have an injury, right? They did something and they feel pain. It can be chronic, it can be acute, but they have pain, and it's about time for them to seek attention, right? So they go to their doctor maybe, or to ER, or they come to see you as a physical therapist. And while you're examining them, you decide that this patient needs an MRI to be able to find out more about their problems so we can continue care or identify what kind of care they need, right? I mean, all of us in what we do have come to a kind of dead end that we want that extra help, that extra understanding of a condition so we can be able to put together a plan of care. So we request an MRI. And what happens most of the time? Most of the time, what we get a denial, right? I mean, denial after a request for an MRI, it's always the case, at least in my career, that's what I'm getting. So what is the doctor wants us to do, or even if it's us, right? What we do, we start physical therapy. If the insurance says, no, you're not going to get the MRI, you're going to go first for physical therapy. You're going to do 3 times a week for the next 4 weeks, total of 10, 12 visits. If you're not better, then I'm going to send you for an MRI. So they come to us. We start, like so hard work as we are and passionate about helping the community, right, and our clients. What do? We provide 3 times a week for the next 4 weeks, so 10 or 12 treatments. Out of their 20 visits per calendar year, this patient has only 20 visits for the whole year. So we did 8 up 10 of them. And we realize after 10 visits that there's no results. The pain is still there. So what happens next? We go for an MRI. Of course, now there is an approval. And of course, the approval says that there is a rotator cuff tear, right? What happens? This is a significant rotator cuff tear. We cannot help it as therapists. They need surgery. They go for surgery. What's the result? They come back to us for treatment. You have only 10 treatments left. How much you can do in 10 treatments? This patient, they might need few months before they go back to normal. So you can see that we're going through that failed PT scenario, waiting for the system to approve something so important as an MRI to figure out what is going on with the patient, right? With our patients. And by the way, our reputation is at stake here. Because at the end of the day, you provide treatment, you cannot make them better. Who is the bad person? Usually the physical therapist, unfortunately. In any case, that was one of the major issues that makes us, that we decided as a company here and as professionals to start looking into other ways of doing business that it will help the patient to begin with, and it will help us to be better in what we do and provide an accurate treatment. How do we do that? With the use of ultrasound. Interesting enough, I have here a slide, that talks about accuracy of ultrasound. The ultrasound is missing from there compared to an MRI. And as you can see from here, It is so similar. Dark orange is the MRI, light orange is the ultrasound. I mean, just looking at this, sensitivity and specificity, so similar, okay? So nobody can tell you that MRI is better than ultrasound, especially for the rotator cuff tear, okay? Ultrasound can do sometimes even better job than MRI when it comes to rotator cuff. And that slide next to it, you can see the difference in cost. I mean, MRI can cost up to $1,400 or up to $4,000, depending on the insurance, right? Ultrasound is what, $140, $150? That's how much we get paid for an ultrasound if we do 2 joints, right? So it is really cost effective for the system. It is cost effective for the client. Even if the insurance cannot approve an ultrasound, who can do it for them? It's so much less than any other exam with the same or even better results. But the beauty here is what? The beauty is that if they come to you the first day and you don't know what exactly is going on with this joint, with this rotator cuff, with that shoulder, or any other joint, you have the ability right there and then to do the ultrasound so you can be able to see what's happening with the joint. And by the way, you might not have any problems. It might not be the shoulder at the end. You might have shoulder pain because of your neck. That step, though, of knowing that there is nothing with the shoulder as a joint, it will help you to focus in a different area.